Are you wondering why you have calf pain with running? Do you have calf pain during or after you run? Would you like to figure out why and what you can do about it? If so, then stay tuned. This video is for you. Hi everybody, I'm Steph. This is PT to Go for the runner. I'm a physical therapist. I've been a physical therapist for over 10 years and a runner for over 20. And I've helped so many people get back to running injury-free that I wanted to help some of you too. If you haven't already, please subscribe to my channel, hit the red button and the bell so you get notified every time I release a new video. Calf pain is one of the most common running injuries, and especially pain at the Achilles, that lower part of your calf where it attaches to your heel. You may have heard of the terms Achilles tendonitis, Achilles tendinosis maybe, calf strain. Well, today I'm going to talk about why injuries occur in these places and how you can treat them. Who out there is currently dealing with calf pain from running? Give me a comment below and let me know what you're feeling and where you're feeling it. If it's at the calf, higher, or if it's lower in the Achilles. And did it just come on? Have you maybe been feeling it for a little while now? Leave me a comment below. I know I have had my share of calf pain. Thankfully, it's never been a full-blown injury, but I have definitely treated my fair share of people with actual like muscle pulls, Achilles tears, things like that. So I know what it looks like and I know what the recovery is. And I know that's why you're here. So first let's talk about why those injuries occur to the calf and the Achilles areas. As we know, running is repetitive in nature. We do foot strike after foot strike after foot strike for miles and miles. And that puts stress and strain on the legs. And that stress and strain can cause overuse injuries of the calf and down into the Achilles. One of the reasons, which is pretty common amongst runners, is that we don't stretch. So maybe you do not stretch your calf muscles at all after a run. Maybe you don't stretch anything after a run. But you have just now used those calf muscles for 10 miles, 15 miles. Maybe it's only 2 miles, but if you're doing it over and over again and never stretching that muscle out, it's going to get tight and it's going to stay tight. Another reason why you may be having calf pain and Achilles pain is if you have a high arch. So if you have a high arch and that arch stays high throughout your run and is not dropping like it should. So normally when we strike, our arch is going to drop a little bit and then it's going to rebound back. So it drops down in order to cushion that strike and then it comes back up to be rigid when we push off again. So if it's not cushioning down, if it's not dropping down at all, then that can put some strain, especially on the Achilles, because the Achilles is then staying really tight and straight, and it's going to get kind of stuck that way. Then the opposite of a high arch, which would be your arch dropping too much, can also be a cause of calf and Achilles pain. So if the motion of your arch dropping every time you strike is uncontrolled and it's, you don't have the support in your shoes, or the muscles themselves just aren't doing the work they're supposed to be doing in your foot to control that drop of the arch, that is going to cause some issues up the chain. So up into the calf, especially the inside calf, part of the calf muscle, and again on the Achilles, because now it's moving too much versus with a high arch, it's moving not enough. So now it's moving too much and getting stressed and strained. And then sometimes the reasons why you have calf pain from running is simply because of the overuse, the repeated foot strikes, and then sometimes something just breaks. Maybe you decided to wear a new pair of shoes that day, maybe you didn't. Maybe you took a different route and so you ended up going a little farther than you have before, something new for your body. Maybe there were more hills on that route. Maybe you accidentally stepped on a pebble or a crack in the sidewalk and you twisted your ankle a little bit, but it didn't really bother you, so you were able to keep running. Things like that. Sometimes pain can happen and injuries can occur. Sometimes something just breaks. But I have good news for you. This is treatable and preventable. The first thing I would tell you for in the future, because if you're watching this right now, you've likely had pain long enough that it has either sidelined you or for some reason you're looking for help, right? So in the future, after you've recovered for what you're currently dealing with in your calf, I want you to take care of it sooner. Take care of it right away, before it's a pain even. Maybe it feels just like an itch. I don't know, it's something that just slightly annoying, but it's not gonna stop you from doing anything. I want you to deal with it then, because then you take that little bit of time now versus that long amount of time later when you have to deal with recovery from an injury. All right, so how do we treat it? If it's new, it just happened, it's acutely painful, it's a full-blown injury, you need to rice. So you need to rest, you want to ice it if it's inflamed, specifically for the first 2 weeks. You want to try some compression, so some compression socks can be helpful, and that just helps to push all that swelling up out of that area. And then you want to elevate the leg, because that will, again, it will help to get the swelling out, get the inflamed cells out, so that your body can recover a little bit better. Sometimes when people come to me in therapy, I will give them a heel lift, so a small lift in that side, and what that does is it shortens the calf muscle and then the strain on the Achilles, and so that can just give you a little bit of relief when you have to keep going to work and keep going to school and keep going about your daily life. So you may find that if you wear a shoe with a slightly higher heel, that's going to feel a little more comfortable than like super flat shoes. I will also say, on the note of shoes, that during your recovery, when you are walking around, even if it's at the store, Walmart, Target, make sure you have the support you need in your shoes. So don't just go around walking around in slippers or flat shoes when you've got an injury going on, because remember, if your arch is too high and not dropping like it should, so if your shoe doesn't have cushion that it needs, then you're going to increase strain still if your arch is dropping too much, and that is not controlled, and potentially that's why you got your injury. Then when you're walking around, the same thing is happening. So make sure you have the support in your shoes. Make sure you're wearing good shoes during your recovery, because otherwise it's going to be a longer process. Now, as things start to feel better, and even, right away, obviously you should be stretching anyways, but definitely as things feel better, start to get more into stretching. And I want you to get the gastroc, so the big meaty part of the muscle in the calf, and then the smaller soleus muscle. So gastroc is where your knee is straight when you're stretching. Soleus is when your knee is bent. So that's going to be a little lower in your calf. And they both tie into the Achilles. So we need those muscles to be loose and moving properly. Otherwise, the Achilles is going to continue to be strained. We want to start to do some strengthening to that area. So we want to start to load the tissue gradually and slowly so that it can align better when it heals. So you're not stuck with this jumbled up scar tissue. And we want to do eccentric strengthening. So that's more of a slow lowering of the muscle. So you see here, I'm going to raise up on my tiptoes on both. I'm going to shift my weight to one side. So if my injury is on my left, I'm going to shift my weight to my left, slowly lower my heel down. So I'm eccentrically working the muscle. And then what's nice about this is you can drop right into a stretch. So we would go through, and do 10 reps of these, nice and slow, once a day, down to every other day as you're getting better and better and having less pain. We also want to draw your body's attention to this area again. So foam rolling, using a stick, using a tennis ball, making your body more aware of those areas of pain and tenderness again, so that we can get it to lay down nice smooth tissue again, so it's not all jumbled and scarred. So we need to kind of really work in and get some of that kind of good pain, good hurt, where it hurts at the time, like when you're on a muscle knot, but then once you're off of it, it starts to feel a little bit better. That is the kind of soreness we're looking for when you're doing work on the soft tissue throughout the calf and the Achilles area. Okay, and I didn't forget, of course you want to keep running as much as you can. So if you can, here's my rule. If you can walk without a limp, because limping is not helping you at all. That's going to create an injury in some other area, so please don't do that. As soon as you can start to walk without a limp, you can get back into, I would suggest, run walks. So kind of some intervals, again, to make sure you're not straining or stressing that tissue in any way. And we want to make sure your pain doesn't elevate. So I know you've been to the doctor or a physical therapist maybe, and we have that 0 to 10 scale. So 0 is no pain at all. 10 means we need to be taking you to the ER. So if you are running or walking or doing any kind of workout and your pain gets up to like a 5 out of 10, so that's right in the middle, it's definitely more than, you know, that itch, but it's not as bad as we need to go to the ER. If it's as bad as you need to go to the ER, please go to the ER. But hopefully you are less than a 5. Then you're good. Keep going. Okay. If you get to that 5, you need to back off. If you get to that 5 and more, you need to back off. If you get to the 5 and then once you're done with your workout, it stays at a 5 or it's more than a 5 for more than like 2 to 3 hours, you need to stop. That means you are causing more inflammation and more injury to that area. So we need to back off, kind of reset, restart from where it didn't hurt to where it didn't get you up to that 5, and then you can gradually work your way up again without having that pain. And then just a couple notes about preventing. So of course, once you're over this, you want to prevent it from happening again in the future. So you're already aware of making sure you're stretching, which includes warming up those tissues, so dynamically warming up those tissues, stretching afterwards, using your foam roll. Okay, but what about shoes? So make sure you've got a shoe that fits your foot type. And most running stores, especially the local ones, those are the good ones, will be able to tell you what type of shoe is good for you. And then I want you to work on your form. So if there's a breakdown in your form somewhere, that could be causing some of the problems as well. So if you've got questions on that, comment below or send me a message and I can help you with that. All right, let's sum it up. So why do you have calf pain with running? Most simply put, it's overuse. In one way, shape, or form, something is breaking down somewhere for some reason and an injury occurs. My biggest advice is to take care of it when it's just that itch, when it just first starts, so that you don't have to take all that time later on. Make sure you're dynamically warming up that area. Make sure you are using good shoes, you have good form. Make sure you're stretching, foam rolling, and using your stick on the calf muscles after and in between runs and workouts. I hope this was helpful. If it was, please hit the like button, share with your family and friends, and thanks for watching.